Good evening. My name is Tamara Hilton from Interdisciplinary Capstone, IDS 4934, Kaiser University. I'll be speaking to you today about the prescription drug abuse epidemic in the United States. In 2007, there were 27,000 unintentional drug overdose deaths in the United States. That is 1 in every 19 minutes. According to Dr. Jeffrey Cohen of West Virginia University School of Medicine, among ages 35 to 54, drug overdose surpassed motor vehicle accidents as the leading cause of unintentional deaths in 2005. In 2010, 15,323 women died from drug overdoses. That is a 400% increase since 1993. This increase in overdose deaths is due to the overprescription of opioids such as methadone, morphine, OxyContin, and Percocet. According to the National Institute on Drug Abuse, more people die from overdose of opioids than all other drugs combined, including heroin and cocaine. This increase in available prescription drugs and the attitude by patients towards their use and or misuse of these prescription drugs have made this epidemic an immediate need for intervention. How are these prescription drugs abused? You would think that prescription drugs are abused by individuals who get them family member, friend, or drug dealer, or better yet, they may have stolen. But the US government researchers found that 1 in 3 opioid abusers acquire their medication from their doctor. Taking medications prescribed for someone else, taking medications in higher quantity or in a different manner than prescribed, or taking the medications for something other than prescribed are all ways that the prescription drugs are abused. National Institute on Drug Abuse stated that in 2013, 207 prescriptions of opioids were written by doctors. This data is quite alarming and leads me to acknowledge some changes that need to be made to rectify this epidemic. Well, what needs to be done? Prescription painkiller abuse death has become a major public health concern. Implementing strategies to resolve the problem need to be handled at state, local, federal level, as well as engagement from parents, policymakers, and health professionals. In order to fix the problem, doctors need to rethink the type and quantity of medications they're describing and prescribing. Public health needs to get better messages out to the public in terms of dangers associated with abuse of prescription drugs. And patients need to be carefully screened and followed up, monitoring, mandating. Physicians need to be better equipped to identify patients who are non-medically using and help them in regards to legal markets for distributing prescription drugs need to be mandated. Improvements need to be made about the way in which drugs are prescribed. The FDA has made some strides to resolve this issue. They have recommended tighter restrictions on hydrocodone products. The DEA has mandated that drugs containing morphine or OxyContin need to be handwritten and are called into pharmacies, making it mandatory for physicians to see their patients and assess them. We're used to seeing prescription drug overdose headlines related to celebrities, but this is a serious matter affecting all Americans. How many more people per minute have to die for us to hold all unscrupulous doctors responsible and accountable for prescription drugs they are issuing to patients?